Hi, I'm Natalie Sandhouse, and this is my proposal for expanding the nurse navigator role into specialty, starting with rheumatology. So, Austin Regional Clinic is a multi specialty clinic with many locations. They started with family practice, and over many years, they expanded. At this particular facility, this is the only facility that houses all specialty physicians. The idea for the nurse navigator role came to me shortly after Austin Regional Clinic had announced that they had expanded it to patients with diabetes and lowered hemoglobin A1C overall. It made me think of how the nurse navigator role could be expanded into specialty areas for patients. They suffer from chronic illnesses, and a nurse navigator role could benefit them. My contact here is Janice. She's the nursing supervisor. So the perceived needs would be to lower overtime, decrease patient hold times, coordinate care, manage disease progression, and provide patient education. Stakeholders involved would be the rheumatologists, patients, the nursing supervisor, human resources, nursing staff, the clinical transformation for population health and clinical quality nursing director, regional directors, there are two of them, and the COO. Stakeholders that would support the project would be the nursing staff because they would have fewer tasks to do, patients because they would receive better care, and the rheumatologists would be able to see the benefit and support it once they realize how it benefits their patients. I would address this group first because once they are on board with the project, they can help influence those that may resist. Since the physicians are part owners of the company, they would hold more weight with that. The stakeholders that would be neutral to the project would be human resources because they're in charge of recruitment and onboarding. The nursing supervisor at Far West Medical Tower because she would just need to provide space for the nurse navigator. She would not directly oversee the duties. And the clinical transformation for population health and clinical quality nursing director would also be neutral because they're in charge of all nurse navigators. However, they would just need to hire a new nurse navigator. The stakeholders that might resist the project. I listed rheumatologists as well because of financial reasons. They would have to also take on a new employee. The regional directors, because again, for financial reasons of hiring a new employee, and the COO would have to build the job role as well as the financial reasons for taking on another new employee. The goals would be to improve patient care with education, coordinating of care, and treatment support. Current nursing staff will have better work-life balance and improving patient flow. The requirements would be to hire a registered nurse and train said registered nurse to be specialized in rheumatology. This can be done with the help of registering with the Rheumatology Nurses Society. That once you're registered with them, they offer many training opportunities that also offer CEUs. The tools that we would use would be the overtime report and telephone hold time report and patient satisfaction surveys. The overtime report and telephone hold time report would be beneficial to establish a baseline prior to starting this project. And the patient satisfaction surveys, Austin Regional Clinic already has this implemented. They would just need to implement it into the nurse navigator role. So Wolfart et al. 2018 discusses how patients can benefit from having a navigator to facilitate patient doctor communication. The navigator was also able to provide medication and diagnosis education, as well as developing strategies to encourage adherence improvement. Bailey's et al. 2018 discusses the role of an oncology navigator. Oncology patients have similar needs as rheumatology patients. Bailey's et al. 2018 mentions that the oncology nurse navigator should advocate for quality patient-centered outcomes and communicate between the patient and the healthcare team. They also describe that the nurse navigator should coordinate the care of patients, assist patients and their family caregivers, and provide education and resources to facilitate informed decision making. Pasma et al. 2017 discusses how patients that are non-adherent with their DMARDs will have higher healthcare costs. This could lead to sooner changes in therapy, causing a change in cost for the patient. Pasma et al. 2017 notes that patients who adhere to rheumatologists' prescription have better outcomes regardless of the underlying treatment and therefore have lower healthcare costs. This suggests the need of a nurse navigator to help build the strategies for better adherence. Parker and Fuller, 2016, suggests that nurses are well placed as coordinators for patients with chronic disease. They mention that it may be crucial for the nurses to be trained for specific areas of medicine. Parker and Fuller, 2016, note that the more direct activities included patient assessment, care planning, case management, enhanced communication for patients and providers, monitoring and adjusting clinical patient care, and evaluating health outcomes. They suggest that this level of care will improve patient outcomes. Meng et al. 2012 noted that patients with complex disease and diagnosis benefit from more coordination of their care. They also noted that as patients aged, they needed less and less care, possibly showing that they received the knowledge needed for appropriate self-care from their nurse navigators. This would be beneficial for the nurse navigator role to show that patients may not constantly be reliant on the knowledge and coordination of the nurse, and that they may graduate from the program. Thank you for consideration of the role of nurse navigator expansion.